Everybody, my name is Natalie Yeadon, and I'm one of the co-owners and managing directors with Impetus Digital. Impetus Digital has built some of the best-in-class asynchronous and synchronous virtual collaboration and communication tools for life science companies. We've helped companies for the last 12 years across the globe, doing everything from virtual advisory boards, working committees, publication groups. We've helped people with changing clinical trial protocols with their investigators. We've actually helped with brand plan rollouts, sales rep training, and all kinds of really cool things in the virtual space. But more importantly, at Impetus, we really believe that everything starts with a courageous conversation. By starting with these big, hairy, audacious conversations with some of the provocateurs, some of the leading edge thinkers, people who are doing really leadership, high quality things in the space, like the Lygeias of the world, is we are looking to collectively and positively work together to change healthcare, to positively disrupt it, to move things forward. And I'm super excited to be able to have one of these provocateurs at the table today, and this is Lygeia Ricciardi. Lygeia is actually a passionate and a really proven leader who's been focusing on empowering consumers as partners in and through their digital information tools. Since 2018, she's been an advisor at a company called Carium, and we're going to dig into what exactly they do. And they offer a platform for collaborative health that links patients with care teams and helps to sort of discern and help them with their goals, providing support, empowering them with actionable data and really rich human interaction. And that's a core thing around connection today, especially in the COVID-19 world that we live in. Prior to her current role, Lygeia founded and led a company called Clear Voice Consulting, and also worked as the director of the Office of Consumer eHealth. This is actually a part of the US Department of Health and Human Services. She has also been named among one of the most influential and most powerful women in health IT in 2019. So super cool to have her here to talk a little bit about that, and also a HIMSS digital influencer for 2020. So thank you, Lygeia. Such a pleasure to have you around the table today.
So nice to meet you, Natalie, and to have this conversation. I'm excited about it.
Awesome. What an amazing career. You have actually gone from studying at Harvard to doing consumer engagement consulting and then landing in this role as an advisor at a digital company called Carium. I think there's many people who'd be interested to see how that really diverse trajectory got you to where you are today.
Yeah, so I guess if you look at my role or maybe my resume on paper, you might go, wait a minute, she's in the private sector, she works with startups, but she's also worked in the government twice, and she's worked in a nonprofit. How do all these things fit together? But there's been a really constant theme throughout the whole, and it's all about using information technology, digital technology, and using it to empower people, individuals, especially in the context of their health. Other than that, I'm just curious and excited about this topic, and I kind of follow wherever I think I can have an impact and make a difference. And so that's led me to a variety of different kinds of roles, but always with that theme.
So you are now advising. So you
Yeah.
obviously have a lot of expertise with the company at Carium, and we're going to tease that apart. But I'm just curious why you selected or they selected you. What expertise do you bring to the table? What sorts of nuggets and pearls of wisdom have you learned through the course of your career that you're bringing to the table today?
So the reason I started working with Carium a couple of years ago was, first of all, a really terrific group of people. Secondly, they shared the kind of vision and passion that I have felt for a long time about really empowering consumers on their health journeys, starting with the individual and thinking out from there to the health system, rather than the other way around, which is what we so often do with digital health. We think about how hospitals or even apps or insurance companies or whomever might reach out to an can engage consumers and pull them in. Carium says, okay, let's start from the person themselves and build a tool from that perspective. So we certainly shared that. And I was excited to go from a variety of other roles, including ones in policy and so on, to actually, working with them to build something that would make that real. So the platform that we've developed is a platform that connects patients and providers within the fabric of daily life, which of course we started working on way before COVID, but it's become incredibly important now that not only we're wrestling with, of course, the challenges brought by COVID itself, but the fact that we need people to be socially distant, to not go into the hospital, particularly people who have underlying health conditions, are older, frailer. And those people are able now to use our platform to manage diabetes, heart disease, and a variety of other conditions from the safety of home.
So Carium is basically a technology platform that merges and melds and enables this communication between patients and their healthcare teams.
Yes.
So you were working on this before COVID-19. So there's obviously the pre-COVID world at Carium and then the post-COVID world at Carium.
Yeah.
What was the dynamics of how this tool was being used prior? And has there been an acceleration or a modification in the utilization since the COVID-19 pandemic?
Yeah, I think the main change has just been that prior to the pandemic, I feel like when we were explaining what we did and what our vision was, people were like, yeah, right. That's not going to happen. People are going to go into the doctor. What are you talking about? And now people understand that it's actually a necessity, hopefully not just in a pandemic, but going forward, for healthcare to be interwoven within your life, not to be this kind of separate thing. So I think one thing that we've seen for patients who were already using the platform prior to COVID and are now using it, I mean, they appreciated it before because it's less hassle. Most people don't want to take a day off of work or take their kid out of school or whatever that may be to go in and see a healthcare provider on their terms and sit in the waiting room and fill out the forms and all that stuff. It's much more convenient to have a care provider like literally at your fingertips as you need them and to communicate in a much lighter touch fashion. But now people just really get that they're grateful for it, not just because of the logistical savings, but it's the peace of mind. People are worried now, I have this symptom, I have that symptom. Is it worth the risk of coming in? You still can do that as an option, but being able to manage those things, I think it's helped a lot of our patient populations with anxiety and stress that I know countrywide and beyond the country, worldwide, we're experiencing as a result of this pandemic. It's helped with that aspect of things, really keeping a connection going. And I will say also for providers, I think we're seeing a similar thing in that obviously providers don't want to increase the risk of exposure any more than is necessary to patients. And they're able to know what's going on with their patients at a distance, not necessarily by doing a video consult all the time, as some telemedicine platforms offer, which is a great augmentation as well, but just through a light touch sort of text reminder or reminder that like, it looks like one of your measures that we're following is out of range. Do we need to have a conversation about that? What's up with your blood pressure? Did you remember to take your meds? You can have these kind of conversations without stopping everything and like making a whole big deal of it. You can integrate it into the flow of life.
So Carium as a concept or as a platform, how are the providers finding you? So, I mean, outside of, discussing your marketing and what have you, but how do people differentiate you from, like, let's be honest, there's lots of people who've been racing to the finish line here in the light of the COVID-19 and needing these portals and needing these connector platforms.
Yeah.
How are people specifically finding Carium? And is there something specifically that's differentiating that makes this one stand out?
Yeah, so I think one of the things that's critically different about us is that we do have this vision of broader, deeper care transformation that really is about the patient, as opposed to about sort of being a stopgap because we're not able to continue medicine as usual at this moment. So we're a platform that's not specific to a particular type of condition. So we're not limited, for instance, to diabetes or what have you, but we can apply our tools to a whole variety of different use cases. And we have different customers that are doing that and that are finding, particularly within larger healthcare systems, that they can use it across different departments. So, over the course of your life, at one point you might say, be pregnant. At another point, you might be headed in for an operation that has nothing to do with, your previous statement being pregnant or state being pregnant. But you can sort of manage that as well using the very same platform over time. It's the fact that you as an individual are going to, as a patient, be in a variety of different roles and positions, really. And the platform is able to work with you as a patient and your provider to support you across a variety of different use cases like that. So to sum up, the folks that are working with us are the ones who have and had already before COVID, many of them, a long-term vision idea that like, okay, care has to be more patient-centric. And that's not only because, oh, that sounds nice or it's the right thing to do, but because a lot of payment models, certainly in the US, are moving toward more value-based care models in which I think the only way you're going to control costs in the long term is by really engaging patients as partners within their health, not just their health care, but their health. And that means things like watching what they eat, thinking about how much they move, really using, wearables to track what's going on in their daily lives and managing their health on a day-to-day basis, as opposed to just kind of waiting until health problems arise and then running in to see their doctor.
Yeah, so it's really nice that you've built a lot of this already into the system. And one of the questions comes down to is people use things based on habits. Our brains are lazy.
Yeah.
We get into, thinking fast and slow, sort of the Daniel Kahneman concept. And again, at the end of the day, automaticity and what feels right and natural, and we get into workflow. And so part of this was the horrendous obstacle of trying to get people to use electronic health records in the first place. And now that this is mainstay, the next big question is, how do you take portals, platforms, apps, that sort of thing, and bridge it or get it to become interoperable with these systems, these, electronic health records that people are already using? So what is the sort of secret formula or plan to integrate Carium into workflow so it feels natural and it's easy for people just naturally to use it?
Yeah, I don't know that there's a secret formula per se. And I think it's really dependent customer to customer, like how people are using it. So as you described early on, and you're right in saying that Carium helps connect an individual, not just with their doctor, but with their care team. So an important point there is that they're usually not having a one-on-one, say, conversation with the MD, but that there are nurses, physician's assistants, and other allied health folks who are part of a health team that is managing an individual. In many cases, we've found that members of that team like to use the Carium native app because there's just more richness and they're the ones who are in there much more often. But they may again pull in that MD as a part of their care team to say, hey, here's what's going on with this patient, Natalie. Like, this is where her stats have been tracking over time. Something has changed. What do you think? They may like bring that person in for that particular discussion or integrate that into the EHR, but they don't need to pull in every single reading about everything maybe that you ate over the last week. No doctor, well, I shouldn't say no, but in general, many doctors are concerned about, I don't want information overwhelm. We have sort of a varied approach by which you can kind of like pull in or use what you need. If you want all that really, rich detail, you can use it in a variety of ways, but one is through our own interfaces. So you don't have to have that in the EHR, that's fine. But then you can pull in really critical things. You can set your own limits for like, if I have a patient who has a heartbeat that starts going in a certain direction or hits a certain threshold, I want an alert. I want to know about that, but you don't have to pull in all the data.
I think that's actually brilliantly said. And in the world that we live in today, where data is the new oil, It has to be refined. We're piling all this stuff into data lakes, and all kinds of people are using it in population management, all that sort of stuff. There is the concern of data overwhelm, especially with these 24-hour Bluetooth type of devices, glucose monitoring. We're looking at all kinds of other companies that are doing embeds and aortas, and we're checking blood pressure and oxygenation and all kinds of things 24/7. You can have all the data that you want, but there is that sensibility of overwhelm. So I think that's brilliantly said. And it really does bring up the curious question is, what is going to be the evolution of the physician or the allied healthcare provider? Are we seeing skills going to be changing in the future? Are these people going to be required to be like data scientists? What's your thoughts on that?
I think so. You're asking some good questions. There are a variety of roles. I think in general, we as a society need to be better at understanding and applying data to our own lives. And I say that not just for healthcare providers, but also as patients. I think there's been a lot of confusion about COVID, what spreads it, how to handle it, not to mention a variety of other issues. We all sort of, as a modern day society, not just in the US, need to better understand data and its shortcomings and its risks as well as its strengths. It's very powerful, but you need to understand how it can be potentially misused. So, but to your question about specifically how skills might change, I think in some ways, you've got to have someone in an organization who's really good at interpreting what do different levels mean, what do trends mean, can I see bigger trends, all of those kinds of things. The kind of pop health skills are really important. On the other hand, another skill that I think we need a lot more of in our society is the sort of direct human interaction encouragement stuff. And this is often more the role of the allied health professional, somebody who on a daily basis, we've worked with nurses who have developed really deep personal friendships and relationships with patients, such that they're not only encouraging them and helping them, sort of nudging them toward better behavior, but helping patients to learn and incorporate those habits, which takes time and motivation and kindness and all these sort of empathetic skills in order to, want to really make long-term changes in their own lives. And we're seeing that in a variety of places. Like we're working with Atrium Health, we're working on patients in pre and post surgery. You need to have special skills to help people get over their nervousness and anxiety, for example. So it's not just about the sort of hard data science skills, it's also about the human empathy parts of it.
So it brings up a really interesting concept around incentivization. When we talk about things like systems thinking, and systems innovations, we ultimately know that the reason for things being the way they are is it's about people and how they're incentivized. And so currently we run health systems that incentivize certain behaviors and certain individuals in doing certain kind of work, specifically the traditional physician, in whatever capacity. Allied healthcare providers are still part of this. But one of the questions comes down to is now that we're enduring, and still enduring the COVID-19 ramifications and all of the impact that this is going to have specifically. We talk about mental health, but there's probably many, many shades of gray of what that looks like and the impact on all of our lives. Is there going to be greater roles for these coaches, consultants, people that are on the fringe that don't participate in the usual billing codes? Is there going to become a more expansive way of including these individuals just so that we have the bandwidth to manage the need that will probably be inevitable from this pandemic?
I think there has to be, to answer your question, because there's certainly a shortage of healthcare providers here in the US, and I know in many other places around the world, and that's intensified by COVID. People are burnt out, overwhelmed. Yes. And in fact, in some, payment models, for example, remote patient monitoring, we're beginning to see signs that something that's reimbursed by CMS that actually explicitly includes some of these allied health professionals. And so we need to sort of broaden the team, but we also need to rely on technology where it makes sense. And what I mean by that is sometimes people think like, oh, if we bring in computers, if we bring in technology, we somehow put doctors and nurses out of business or we dehumanize care. I don't think that's the case at all. We can allow humans to do what humans do best and take away some of the sort of busy grunt work, if you will, of even figuring out, like if a human sets a level, like do not let the patient's, I don't know, blood pressure go above this level without letting me know. And the machine can just kind of like track that. That saves somebody's time. Great. That time can be much better spent either analyzing what certain trends mean or making a human connection with that person and saying, hey, you know what, Bob, when you went for a walk after dinner, I noticed that your, blood sugar levels dropped. Let's talk about that and doing it on a regular basis. I think, though, machines can do a little bit more than just the sort of grunt work piece. I mean, you were alluding to sort of motivation and gamification, I think, is another important thing. That's something that we're using, for example, at St. Luke's, where we're integrating gamification with patients there to encourage them to, overcome sort of a lot of us here in the US have, gained the sort of COVID-15. People aren't getting the exercise they need to. So how can we encourage, even in a lighthearted, fun way, people to get out and move? So there's a lot of ways in which we can use technology to enhance what providers are doing and then also bring in different kinds of roles. Yeah, it's not scalable or sustainable from a cost perspective not to do those things.
Absolutely. So lots of neat things to sort of double click on that. One of the questions, or one of the interesting elements of Carium, or one of the hooks, if you will, is very much what you've actually suggested. People are worried about getting out of business or having these, robotics taking over their jobs, and physicians and healthcare providers are included in that. But I think what's interesting is, and I think in how you sort of geared Carium, is that you're trying to leverage the opportunity to show how your tool, Carium as a platform, can be utilized to increase streams of funding, increase streams of revenue. And you've meant, and so I was wondering if you could touch on that, everything from remote patient monitoring to chronic care management, what we mean by principal care management, and the whole virtual visit. So how do you package that in such a way where, not that it's a lure, but it's an interest point to make sure that people know, hey, this is actually not against me. It's actually something I can use.
Yeah, I mean, it's great that you bring that up because that's certainly something that we've experienced, particularly during the pandemic. Of course, a lot of healthcare providers were under strain financially, as well as from a kind of care provider bandwidth perspective, because a lot of the procedures that we're bringing in greater, dollar amounts for them are no longer being performed if they're non-essential, or if people are too worried and afraid to come into the office. So a lot of folks have been hurting financially. And so certainly the reimbursement opportunities offered by CMS and a lot of private insurers related to, as you say, RPM, chronic care management as well, PCM, there are a variety of different programs, as well as virtual care that is reimbursed in ways that were not previously. It's interesting. I've worked in health and information technology for 20 years plus. And I would say in the late 90s, we were talking about, could we please, maybe figure out a way to reimburse for telemedicine services? And it hasn't happened. Finally, it takes a pandemic and 20 years to get people to actually say like, gee, that might make sense. And I know that a lot is in flux right now in terms of figuring out which of those payment models will stay permanently and not just on a temporary basis during a kind of pandemic moment. But I think it's pretty safe to say that the government has been pushing toward this direction of enabling that kind of care to be reimbursed over time. And again, as a piece of a broader shift toward value-based care, which is ultimately, I think, going to be really critical for improving, use of things like virtual care generally, but also for this patient-centric idea. Again, I strongly believe that people are healthiest when they take agency in their own lives and in their health, and understand, and maybe even are rewarded in a variety of ways for doing that. But we need a payment system that encourages that too, that encourages patients to be engaged in their care and to engage in preventive activities, in things like exercise and eating well, so that we never get to the point of needing those expensive interventions that as individuals, we don't want to undergo anyway. We need to understand that there's a direct relationship between our everyday choices and behaviors and where we're going to be in our health. Maybe not immediately, but certainly in 5 years, 10 years, 20 years.
Absolutely. So absolutely essential. We talked about workflow and automaticity as it relates to physician habits, but habits affects every one of us. I mean, we hear all about this all the time with neuroscience and cognitive science. This is going to be the mainstream way of thinking about everything that we do in our everyday lives, including us. We're all patients or potential patients. We're all digital consumers. We're all people who have the potential to be in and out of a healthcare situation. And so preventing that is so absolutely essential and a big part of day-to-day conversation. So I'm just curious about Carium's role in that revenue stream opportunity, and or I guess gap filling between what payers are doing and what physicians are providing. What data sets are being captured by Carium that can be shared for reimbursement, and how do you bridge that gap so that the physicians who are tapping in with patients, monitoring their heart, you actually have all kinds of tools around surveys and dashboards and checking their blood pressure. There's the video chat and the messaging, but
Yep.
which one of those tools are being conveyed back to the payers so that they're going to get reimbursed? Or is this part of a process for advocacy to say, I have this data, I should be paid for it, for population health management,
probably
et cetera?
both. So in programs like the remote patient monitoring program, there are very specific requirements spelled out by CMS and by other payers who may reimburse slightly differently, saying, I need to see that a certain number of readings have been recorded on a certain number of days, and they can apply to certain kinds of chronic conditions. Those kinds of details are actually spelled out. But I think, to your bigger point, there are opportunities to think more broadly about telehealth and what it might look like. What are the readings that show that somebody is assuming a healthier behavior? I think there's a lot of room for that. And I think that RPM, this program was put in place prior, fortunately, to the pandemic. But I think it was a sign that the government is definitely, as I said, moving toward this value-based payment model and wanted to try this out, and is also, trying a variety of different payment models with ACOs and other alternative organizations that are really pushing the envelope on this. I don't know exactly what's going to turn out to be sort of the mode of choice. And I'm sure it will vary among, CMS often kind of sets a course that is followed by many other private payers, but in some cases too, that, you can have private payers who are extremely innovative in how they do payment models. But I think in general, it's safe to say that we're going to see more integration of data from the home, more health and healthcare taking place in the home. That's just directionally where things are going, in part because we have the opportunity to do that now. Not only does most of the population have a smartphone, which is with us most of the time, but increasingly we're building sensors into everything. I mean, you think about the number of people who have smart assistants in their homes, whether it's Alexa, Siri, whomever. I have a smart refrigerator, which it's mostly entertainment, to be honest. But as we see more and more sort of everyday objects with sensors embedded in them, the opportunity to not only measure behavior, but also to nudge people toward healthier behavior will increase. And I imagine that the regulatory landscape will, again, with time, kind of follow and incorporate some of those measures too. I mean, for example, like I'm just thinking about insurance companies and how with sort of car insurance, you can get a discount if you don't get any driving tickets or if you're driving well. You can envision a lot of organizations, including maybe self-insured payers, taking that route where they're giving people bonuses. Some already are, as a type of incentive for changing behaviors. So it might be something like, hey, you can get a free gym membership or whatever, but it may also be other kinds of incentives. And I know that, monetary incentives can be a part of what's inspiring to individuals, but I think also social incentives are something that ultimately drives longer term behavior change. It's often kind of peer pressure and a sense of wanting to be part of a group, or maybe wanting to make the world better. Those are all reasons why people agree to participate in various health trials and other kinds of things. And if we can hook into those kinds of motivations, in addition to the more basic, often financially oriented gamification models, I think we can start to really move people toward behavior change. With that, and as I said, changing environments, embedding sensors and designing environments that encourage healthy behaviors.
There's just so many things. I could probably talk to you for hours about this stuff. It's also very interesting, but you've said so many important things there, including the fact that the incentivization and how does that work. And what's so interesting about this is that just like we talk about precision medicine, there's precision incentivization based on people's characters.
Totally.
So I don't know if you've ever read that book by Gretchen Rubin. She was so eloquent, talking about the 4 tendencies and being an upholder or a questioner or an obliger or a rebel.
Yep.
As we start to drill down, and I think the COVID-19 pandemic has really illustrated the differences. For example, just the simplicity of the concept of wearing a mask. You can call it political weaponization or whatever you want to call it, but there's some people with some very distinct truths and belief systems about that one little thing. Now, this is the uber specialization of incentivization. How do we speak to a rebel versus an obliger? And as we drill down into further characterization of people, is how do we, and so it leaves room for the Cariums of the world and other platforms of the world that might say the thing differently or do the thing differently. How do you believe that behavioral science is going to evolve based on some of the things we're learning through this COVID-19 pandemic?
Yeah, wow. Okay, there's a lot going on there too. Clearly, at some point post-COVID, we're going to have to in the real world somewhere, like have a drink and have a real conversation about this in more depth. But I have to say also, fun fact, so Gretchen Rubin and I actually both were at the Federal Communications Commission at the same time.
Wow.
So, so it's, I love a lot of the stuff she's been delving into around happiness. Yeah. It's really
her and Brene Brown, big fan of both.
Yeah, I love Brene Brown too. Okay, so let's see, so much to unpack there. So, okay, it has been really difficult for me who, I've spent like 20 years thinking about the patient or the individual's role relative to their health and wanting them to be empowered and feeling frustrated that often people don't feel empowered enough. Finally, we have this pandemic, which is a horrible thing, but also an opportunity for many of us to protect either our own lives or just as much or more so the lives of others through a really simple activity like wearing a mask. And yet many people are not doing it and are actively choosing to push against it. And I think what we're tapping into there, yes, you're right that platforms such as Carium could play an important role in changing behaviors like that, because many people, what we're really getting to with that whole issue is trust. Who do you trust? What information do you trust? If you look at surveys, people in general tend to, like the Edelman Trust Barometers, for example, people tend to trust their own doctors. So by all means, if most people had access to a platform like Carium in which they could connect to their provider and their provider's team, and they were saying, hey, by the way, here's why mask wearing may make sense, or if you find this uncomfortable, here's an alternative or whatever. But just to kind of talk people down and like bring in the science and the facts at your fingertips, that could have like potentially prevented a lot of what we're seeing right now. But I think there's also a real issue around just misinformation and information being used often for political ends that's just spun way out of control. And to, you know, what is the solution to that? I think there are many solutions. I don't know offhand, but I will say that in the context of things like medical issues like COVID, absolutely having a tie to a trusted individual who will give good information on a regular basis. If you had if ever all of us were using Carium and had a connection to like our nurse, I think that the likelihood of mask wearing would be, or the prevalence of it would be much greater than it is.
You mentioned something that was important around incentivization, specifically around payers, incentivizing right behaviors, which are connected to patient-reported outcomes.
Yeah.
So where do you see the future of that? And in addition to this, is looking at things like regulatory approvals for new things that we've started seeing, software as a medical device, digital therapeutics, things that are not really chemical pills, and getting beyond that thinking into these other sorts of apps and, you know, like a Carium.
Yeah.
You know, what is going to be the future of that and the enablement of these wearable sensors, these, you know, ambient biometric trackers,
Yeah.
infiltrating and inserting in here, seeing that there is positive impact, and then being able to approve these as products that are impacting positively patient-reported outcomes?
Yeah. So currently, Carium is not considered, you know, a medical device that has to be regulated as such because patients use it in partnership with this team of healthcare providers. There are certainly a variety of tools that are meant to be used in different scenarios that are classified as interventions, that are software. They may be reminders to take your meds, or, well, I shouldn't get into exactly what they may provide, but they have more direct clinical impact without necessarily the direct involvement of a live human who's shaping sort of the inputs to the same extent. I think over time, you know, I think we're going to see more of those, and we should. Again, if we're going to sort of scale health and wellness, we're going to have to move in that direction. It can be certainly a challenging and difficult, I guess it's a challenge to figure out how to do that and do that well. I think the FDA has been really forward thinking in trying to rearrange how it addresses reviewing new types of interventions and trying to look at the company that's producing the interventions and assess their overall practices rather than, or in addition to, just going deep on every little tool. But I think there are a variety of roles, not only for the FDA, but also for maybe more light touch regulatory or even industry kinds of groups to give recommendations and guidance on what may be good tools for particular populations. In other words, not every tool should have full FDA clearance. There's a lot of guidance that people need, both as patients and as providers, to figure out what works and what doesn't. I think some other countries have already done more in this regard. Certainly, I think Britain, the NHS, has already kind of looked at and reviewed a panel of health apps and recommended those for its physicians. And I know there are efforts to do similar activities in the US, and we'll see more of that. But because we have more of a fragmented system, it's not going to be maybe as clean cut. We don't have a centralized authority to quite the same extent. But directionally, yeah, I mean, we as a country need to think more about how better to regulate software in general, not just in health, but more broadly. And I think that's why, I mean, I'm based in Washington, D.C., and we've certainly seen in the recent election more questions about the role of software and technology companies and how I would say for the most part, they have been very lightly regulated to date, and I expect them to be somewhat more so going forward.
Here's the thing that's interesting is the eventual cost modeling associated with this variety of healthcare apps.
Yeah,
Currently, these are being subsidized by people outside of the patient. We've
yeah,
also created an environment where we have an expectation of what we call freeonomics. So using
yes,
Google search is free,
yes,
using Facebook is free, using
yeah,
Twitter is free. And this is what this whole issue has come down to, where people have been testifying and, what does this look like? What's the business model? And it's based on advertising. In the healthcare space, and really as it relates to Carium and others, there's subsidization going on. And inevitably, the patient never has to pay for these apps. How do we sort of see that in the future so that people are investing in their health? How do we change that expectation that everything should be free, including these health apps, and getting them to understand around the long-term benefits, investing in
right.
health, just the same way that people will pay out of pocket for vitamins.
Mm-hmm.
Sorry, and I'm saying this in the Canadian environment because I know that it's a different system in the US where people are, in terms of insurance versus private payers, but they'll pay money for vitamins. So there's a belief that I'm helping myself
Yeah,
versus somebody else should be paying insurance, et cetera, for my prescription pills. So there's almost like a dynamic and an expectation around health apps, what they mean. I'm expecting it to be free. And are we going to fall into the same issues that we have with these big, gigantic monopolies around, yes, I can give you this for free, but I'm going to be taking your data and doing all kinds of things with it. So what's your thoughts
yeah.
on
I
that?
mean, I wish I knew the answer to some of these questions. I think they're of core and really great importance. I mean, it may seem, as you're kind of alluding to, different services and many that we rely on every day, like search, for example, may seem to be free, but at what cost really? Or you look at other, platforms, social media platforms, most of which are free, but often at the cost of pushing advertising your way, or maybe pushing us as a society toward the more inflammatory headlines that get everyone to feel very extremely about different issues just to sort of buy screen eyeballs. That is a problem. That is an underlying problem. And you're right that people do have an expectation, I think, both in general sort of cloud-based tools around social media and search, that they're free, and that also many things in healthcare are free, and don't realize how we are collectively paying in other ways for that seemingly free service. I'm not sure how to break through that directly other than trying to educate people, really. And I think it's going to be hard to move people from that model. Maybe you have to bring in regulation that's more transparent. I don't know. I mean, there are sites like Wikipedia, right, which do not rely on advertising whatsoever, and they're out there asking for money. There are certainly models. Radio, National Public Radio is an example of something that is paid for by people. I've certainly seen a lot, there's a model, and it's now online, but it didn't used to be as much, mainstream media like the New York Times or the Washington Post or whatever, like people pay for that to get the sort of freedom of the voice behind it. I don't know. I mean, here in the US too, there's also this expectation that if it's health related, they're not going to pay for it. On the other hand, as you say, people do dish out a lot of money for vitamins, a lot of money for like weight loss products, dieting, gyms, which is certainly a health thing, obviously food. We are paying for some aspects of things. And I don't know. I mean, I think there's often, it's a really sticky and interesting conversation, in part because, I think about even within food. Let's take food, which impacts our health so greatly. We don't often see in a transparent way how much, for instance, subsidies in the US of like corn production may be shaping what we eat, and maybe coming full circle to impact our health negatively as, people have more instances of diabetes and being overweight and those kinds of things. There's a lot that isn't immediately transparent. And I think if we could make it more so, that would be a start in the right direction. But I mean, honestly, hard questions. I'm not sure entirely how to solve them, except to, again, like I'm always in favor of kind of being as transparent with people as possible. And also, I think there is an important role for Washington and for regulation about helping people maintain trust in what is based in scientific evidence and what isn't. So some guidance and guidelines is really critical.
One of the conversations happening in the big monopolies and the social media platforms is this idea about moving to somewhat of a subscription model for people who want to pay a little extra.
Yeah.
Not having advertising, maybe looking at some more protections of their privacy and their data, et cetera.
Yeah.
It does beg the question that if one was to apply that same model into some of these health apps, and I'm not suggesting Carium specifically, but if there was a subscription model for, you know, certain additional elements, or maybe social credits or incentivization programs, or maybe alternatively the complete opposite, where your data is not shared with payers, because then there's a whole bunch of people concerned about what that could look like.
Right.
Is this going to feed into the next issue where people have concerns about the digital divide? The people who have the latest version of the iPhone versus the nots. The people who have a phone and who don't. People who live in the rural communities who don't have broadband and can't even access telehealth versus those who don't.
Yeah.
So is this, you know, even the subscription model, is this going to feed into that bigger issue of the digital divide?
I think it's a risk. And I think the digital divide is something that has been of great concern, certainly to me, and I know many others during COVID in general, because I mean, if you look at who's impacted most, it's often people who are least able to sort of absorb the strains and stresses of it. It's the people who have to work a job that may put them at risk physically, environmentally, for being infected. It's the people who, because they're, you know, working, they've got to put their kids in some kind of a daycare situation where they're more likely to be exposed, or who have to keep working at that business, otherwise it's going to close and they're going to lose it and they can't afford that. You know, we've seen statistically people who are, for instance, African American are much more likely to get COVID and to die from it. And that follows with certain other groups too that tend to be less advantaged generally. So yeah, I mean, I think this is all a concern. And again, not that it's the perfect answer, but I think the role of government here is to lean in a little harder and try and figure out what is the basic sort of, what are the basic needs that everybody gets, whether it's in healthcare or in communications. It's like access to broadband, for example. I think it is a government issue to a point, like making sure that people get basic necessities, clean water, clean air. Absolutely. Ability to get on the internet is in that group right now, particularly in the middle of a pandemic, but in general it is.
Absolutely. So, yeah. So absolutely important. And what's interesting here, and I think a really positive thing about all of this, is as we start to move into value-based medicine, and as we've actually socialized the concept of medicine since the COVID-19 pandemic, I have never seen so many layperson newscasting talking about mechanisms of action and, you know, efficacy rates that I have in the last, you know, 3 to 4 months. It's mind-boggling. But what we're seeing at the helm of all of this is that everything is becoming very patient-centric. It is all about the patient, which is a really positive spin to all of this. And part of this also has to do with the laser or the magnifying glass that we've put on things like clinical trials. How are we doing clinical trials? Do we require all of those phases, phase 1, phase 2, phase 3, and the level of complexity that's involved with this? How long are we taking? How much time is the FDA and all the other regulatory agencies taking to approve these things and these diagnostic tests, and on it goes? It makes one ask the question about, where does real world data and real world evidence play? And I know that Carium, for example, has a lot of Bluetooth devices connected to it, glucose monitoring, blood pressure monitoring, Fitbit, smartwatches, and on it goes. What is your sensibility around the future of how we discover new services, products, and opportunities using real world evidence.
I mean, I think from, talking to folks in the life sciences, I understand that there is certain value in the traditional clinical trial model, and that it doesn't make sense necessarily to do away with it completely. But I think what we can do is augment trials, whether they're for a pharmaceutical or for more of a device or some other intervention, to pull in all this data. Again, we have access to new types of data. And part of what Carium does is help to pull it all together and make sense of it. Over time, we've had greater proliferation of not just smartphones, but things like smartwatches and other things with sensors in them. Now we're finally turning the corner at a point where we're able to pull these things together and make some sort of unified sense or picture or argument out of all of this. Again, not that we've yet even really fully tapped into this ourselves, but we're beginning to. It's like a glimpse of what if I could pull in more sources of data and start to see trends and start to not only that, but anticipate things like, okay, well, that pattern seems to be happening. We know that people with a particular health profile tend to exhibit these kinds of symptoms if XYZ is happening. Let's intervene before that happens and make a change. I mean, absolutely. I think that's where we're headed. And
yeah, and I think the interesting thing about all of this too, Lygeia, is where the algorithm comes in. And I know some people really get scared when I think about the super intelligence and algorithms and all this sort of stuff. I mean, we sort of see some of this with natural language processing, as you were mentioning earlier, with the Alexas and the Siris. And as these machines start to get smarter, our devices are going to get smarter and they're going to learn. And these so-called software as medical devices are going to change over time. They may not even be, so if you were actually to think about this, a medication that's approved today is going to be the same medication if it's formulated in the same way 10 years from now. But that is not the same thing as an algorithm that's approved today. In 10 years, because of smart, machine learning, it's not even going to be the same thing. So there's questions about regulation, but then there's also the question of, what is this going to look like in the future? Everything from things like implantable devices. We've heard about the Elon Musk, Neuralink that gets embedded into your cerebrum. We're talking about, VR and AR and all of these integrations around learning and manipulation. And it sounds also sort of scary. Where does the person fit into all of this?
It sounds scary, and I'm not going to say it's not in some ways scary. One way that it scares me is that I think it's really important to go back to your digital divide point to make sure that it's not just sort of white male programmers who are writing all the algorithms, honestly, and or including only or primarily white male patients. It's really important that participants on both sides, both in kind of writing code and writing, algorithms, designing products, but then also on the patient side, need to be representative of a broader set of, diverse types of people, different ages, genders, races, etc. On the other hand, though, and I am nervous, certainly. I think in some ways I certainly I get concerned about what could go wrong with technology, but I also tend to be an optimist. And I think that many of the things you listed off sound super futuristic and like, oh my goodness, what will that be like? Until you stop and think about the fact that many of them are actually already kind of integrated into our daily lives already. I mean, you think about like virtual reality or augmented reality. I mean, I have 2 kids, Snapchat, right? Like all kinds of other things like that that people use on a daily basis. Or if you've bought any, sometimes if you buy furniture, for example, over the web or other items for your home, you can see what they would look like in your space. Like those kinds of things are already happening. And they can be and are already somewhat being used in medicine, not just in sort of far off corners, but in some more mainstream ways. I think there's a lot of potential in taking things like remember Pokemon Go and how that was like this massive craze and everyone was into it. Well, in some ways that increased people's like steps for a certain period of time. There's a lot of potential for using those kinds of tools for good. And I forget which other forward-facing technologies you were talking about, but there are many that are interesting. 3D printing in place is another one that's going to be fascinating. I'm kind of looking forward to the day when it's more possible to print your own medication, perhaps locally. Maybe not in my house necessarily, but maybe if I need a really unusual, specific type of drug that needs to be personalized just for me and can be made up for me at my local pharmacy, that'd be awesome. There are a lot of things that can potentially be fabulous enhancements to humanity. On the other hand, technology in general, I don't think is inherently either good or bad. I think it can be used for great positives or for great negatives. And I mean, I've chosen to work in this area and to try and push it toward the positive. But
I am so with you, Lygeia, and I have to say, I mean, I'm gonna end this at the top of the hour very much on that positive note. I love your positive spin on it. I totally agree with you. I think digital, AI, all of these opportunities, it's just like everything, there's yin and yang to it. So it really comes down to mindset, it comes down to belief systems and how you want to leverage it. So again, this probably would fare for an entire other conversation. So many exciting new things. I just want to leave for anybody who's listening to this afterwards or watching this on YouTube, we're going to be leaving connection points with Lygeia in case anybody wants to connect or find out more about Carium. You'll be able to find her there. I also encourage you to check out impetusdigital.com. If you were intrigued by this conversation and there's something going on with your company or your brand or your ideas and you want to have some of these big, hairy, audacious conversations longitudinally over time with various stakeholders, we have the asynchronous and synchronous tools to do this really conveniently and cost effectively. We'd love to hear from you. Please like this, this video and also subscribe so other people can find us as well. We want to thank you for your time, Lygeia. It's been an absolute pleasure. I really enjoyed this conversation and wishing everybody a great day ahead.
thanks, Natalie. It's been great.